All right, I saved the best for last, adolescence. And let me just preface this by saying I have a 16-year-old and I love him very much. And now we'll go. Adolescents are a different breed. Lots of hormonal changes, lots of independence, trying to gain independence. So they can be a very challenging age group to work with. First thing we're going to talk about is the actual growth and development. Now, these guys are maturing into adults, body, and, well, I wouldn't go so much as to say brains as well, because, there's research out there that says the frontal lobe isn't completely mature until about age 25. So these guys are still not mature in that aspect, but their bodies are getting there. Rapid growth, sexual characteristics, all of that happens. Puberty, important to know when puberty starts. Puberty starts around 9 or 10 in girls and 10 to 11 in boys. In the text, it gives the first signs of puberty, and you need to know those. This chapter is really full of a lot of tables and charts that are very helpful. So we'll hit on that when we go to the chapter. The only thing it didn't have in there was the Tanner stages, and I think they were back in chapter 10, the assessment chapter, but I found another slide, so I put it in this slide set. So know when puberty starts. We have to start asking about onset of periods in the emergency department at age 8 now. So it's getting earlier and earlier. Cognitive and emotional development are dramatic. I love how they put dramatic in here. It is definitely dramatic. And identity versus role confusion, it is very accurate for this age group. So there are varying levels of identity formation. Some get there faster than others. Here's the Tanner staging that I do want you to kind of know what happens during each Tanner stage. All right, physiological changes in adolescence. All of their organ systems become mature. Peak height velocity occurs about 12 in girls and 14 in boys. They don't finish growing. The guideline that we use for girls is about 2 years after their period starts. Boys, I don't know, they just keep growing. Mine is 27 feet tall. So, they just keep on growing and growing and growing. Muscle mass increases in boys. Fat deposits increase in girls. Just what happens. Sorry, girls. All right, some other physical changes. Their voices get real deep. They get really leggy. They grow up quickly. Their arms look very long and just Gumby-like. The growth plates at the end of the long bones start to close. They get sweaty in places. Their feet, oh my goodness, their feet sweat so bad. Skin changes, acne comes along, body hair in an adult distribution happens. All right, and like I said, their organ system, with the exception of their frontal lobe in their brain, begins to mature, or actually matures into the adult state. Okay, let's just give some more information. And again, this is all in the text and in the chapters as well. This is a very concise set of slides. So what you need to know about their organ system maturation is on these slides. All right, this is kind of a general overview of puberty. Again, your Tanner stages. If you're doing adolescent health and you are doing assessments, like child checks or whatever, Tanner staging is important. So you need to describe the Tanner stage that they're in. Here is a kind of a general overview again of Erickson's and Piaget's, and we won't talk about Kohlberg, but in the text it breaks it down even more on one of those tables. I'll show you which one I'm talking about when we get there. All right, communicating with these guys. All right. You're either going to get one-word answers or you're going to get a dissertation. So make sure that you allow a lot of time for conversation. Speak respectively. Talk face-to-face. Use real words because they can process those. Yes, no questions are not the way you're going to get good information. So make sure you always ask open-ended questions. Get back to that psych interview type stuff. Be honest with them. Don't sugarcoat things, but don't be too abrupt or too harsh either. Setting limits is very important too. Peers. Now, peers become very important during adolescence. Peer pressure is one of the big things in adolescence. It causes a lot of angst. So make sure that parents know who their kids' friends are and know that they have a big influence on them. And they can have positive or negative influences. Some safety concerns. Unintentional injury, of course, is the #1 cause of death in adolescence. Internet safety is becoming a huge safety concern. Parents need to be aware. They spend, I think that the average is like 11 hours a day connected. So that includes internet as well. So internet safety has to be paramount. There are so many predators out there right now that our kids need to be aware of that. I am not sure how they address that in school. I'm sure that they do. I've never talked to my son about it, but we talk about it a lot because he's a YouTube gamer and he spends some time online, and I spend some time online with him. I have all of his passwords, and that's an expectation, as it should be. Parents should be privy to all of the information, and transparency is very important. Motor vehicle safety, yes. Once they start driving, seat belts, not too many people in the car, big, huge issue there. Substance abuse, firearm safety, water safety, those are all safety concerns and in adolescence as well. Sports injuries are in there. All right, diet. These kids eat Doritos for breakfast, lunch, and dinner. So promoting a healthy diet is a hard thing. Athletes tend to kind of know what their body needs, with the protein and et cetera, et cetera. But with the amount of stuff that these kids have to do, and sometimes their lack of motivation to worry about their diet, they can have some serious nutrition deficits. Fast food's easy, it's cheap, and it's not very healthy. So good choices in fast food are becoming more and more popular. Encourage those. Culture, some families do 3 meals a day, or 2 meals a day, breakfast and lunch, family style. Other families, it's very disjointed in schedules and hectic schedules, and so make sure that that doesn't get lost. The family culture, mealtime ritual type situation. Okay, there in the text it's the recommended diet for, like, I think it's a 15-year-old boy, and you'll see the food groups, like we used to learn the food pyramid, but you'll see the food groups. Healthy People 2020 has a lot of objectives focused around adolescence, and one of them is diet. So we'll touch on those when we hit over in the chapter. When you're assessing the nutritional status for an adolescent, get a good history. Tell them to be honest. Don't let them blow smoke. In drinking water, don't let them blow smoke. Don't let them, if it's something that you really are a little skeptical, make them tell you exactly what they eat, so you have a baseline of what to go on. Fast food, snacks, investigate that. See what they know. I mean, they may not know what they're supposed to be eating. And then help them identify. Like I said, there are some healthy fast food options out there. So help them identify what is healthy, what's the healthier choice. There is a series of books that says that's Eat This and Not That. Those are great for teenagers because they have pictures in them, and it'll show you like a Big Mac from McDonald's and then like a Wendy's, a different burger. Or so Eat This, Not That might be a good source of nutritional information for teenagers. And mypyramid.gov, like I said, that's part of the Healthy People 2020. It's tied into that, and you can refer them to that. It's better to put a hard copy in their hand, because if you tell them to go look that up, unless they have their phone and they can Google it right now, which may be a plus of having, a cell phone permanently connected to your hand like most teenagers do, that would work. Have them look it up. That's a good idea. I just thought of that. Okay, physical activity. Really important. 60 minutes a day is recommended. Real important to stress that with the obesity epidemic that's happening right now in teenagers. This is really really important that they stay active. Yeah. All right, so here's the old pyramid, or I guess it's still there in a sense, but this is what is recommended for a 15-year-old boy daily. Okay, so about 2,800 calories, 60 minutes of physical activity. Talks about limits on sugars and sodium. So stress that. All right, another big part of the adolescent age group is sexual health. Okay, they become more and more interested in the opposite sex or same-sex partners. Their hormones start to develop. So this is something that you really have to address with teenagers. Safe sex, abstinence, sexually transmitted diseases, all need to be part of the education process with these kids. Conversations between parents and the adolescent about sexual activity. You can have those conversations with them. Sometimes parents feel very uncomfortable and they would prefer that the healthcare professional have those conversations. We would encourage parents to have those conversations just to build that trust level between parent and child. But we also need to educate the teenagers as well. Okay, if they are sexually active and they share that information with you, you have to think about providing them access to, the Planned Parenthood clinic or a gynecologist that would prescribe contraceptives or, teach them about contraceptives. All right, some risks that you need to make sure that they are aware of. STIs, STDs, unwanted pregnancy, dating violence is a big one now with all of the attacks on college campuses, and it's really in the forefront of the news, so make sure you educate them on that. All right, some areas of focus to encourage growth and development. Like we said, physical activity, very important. School activities, encourage them to be, do their best in school, plan for college, talk about safety issues, motor vehicle safety, wearing your helmet when, you're playing football or if you're riding a bike. All of those things are really big to focus on. Nutrition, sleep. I think a teenager needs recommended 8.5 to 9.5 hours of sleep. I don't know a one that gets that much sleep, but that's the recommendation. Okay. Hygiene. So as their sweat glands mature, they become pretty smelly. Acne is a big as a big issue within the adolescent age group. So washing their face 2 or 3 times a day is encouraged. Bathing, yes. Deodorant use, yes. They do need to know how to kind of take care of their acne and not pop their pimples with nasty, dirty hands. And so there is some hygiene teaching. Now, unfortunately, some of these kids aren't aware of that. So it may be our responsibility, if we see them in the primary care setting, to address that. Okay? There are kids that have piercings and tattoos, so proper care for those is important for them to know. And tanning, teenage girls, I'm not seeing as much of it as I used to. The tanning salons, but those are all important safety factors to encourage. And I think there's even a Healthy People 2020 objective about tanning. All right, when these kids come into the hospital, okay, so they're going through all of these changes and now they're in the hospital. So that just is an added stressor on top of everything that's going on in their personal/social life. So really important to give them their independence, keep them involved in the decisions. Encourage visits from friends. If they're in isolation, phone visits, or use some sort of Skype, FaceTime type situation. So real important to promote that if they're in the hospital. Here's some developmental concerns, and I think we've talked about most of these. Changes in body image, of course, that's going to be a huge thing during this age group or age range. Peer groups are very important. Violence, suicide, and homicide. Unfortunately, those are part of, included in this chapter in this age group. Suicide, we have to assess every patient that comes into the hospital for a suicide risk, including kids. At age 10, for our triage assessment, we have to start asking, do you ever think of hurting yourself or hurting others? Fortunately, knock on wood, I have gotten some positive, some yes responses on that for kids that have come in with psych complaints, but it happens. And substance abuse, or a lot of times because of peer pressure, substance abuse can be a player with adolescents. All right, some things that might contribute to adolescent violence: family history, gang issues, lack of supervision, drug use, alcoholism, racism. If the kids have been in jail or in juvenile, then they learn a lot of that in there, unfortunately. So lots of things that can factor into an adolescent going to violence. Some risk for suicide, depression, other mental illness, comorbidities. If you have more than one psychological diagnosis or behavioral diagnosis, medications that you're on, social isolation, bullying. Bullying is huge, and you hear about it all the time. So one of the things that, so if you're assessing the child and parents come in and they say, all of a sudden their demeanor has changed and they're giving away things that they normally treasure, like their video games or their, Xbox or whatever, those are weird little signs that you need to be aware of. So teach parents to look for those things. And then if they reveal any of those things to you, then investigate a little bit more as to the suicide risk, because it can come out of the blue. Poor school performance, especially if they've been doing well in the past. All right. And I love this chart in the book because it lists like all of the street names. I learned so much. when I read through those about what different drugs are called on the street. Marijuana is probably the most common. Marijuana and alcohol are probably the most commonly abused by kids and adolescents. And I hate it that it says children, but 10, 11-year-olds drinking alcohol just breaks my heart. Prescription meds are becoming a more and more abused substance, whether it be pain medicine or their ADHD medicine. Those are becoming more and more abused. Bath salts, that's been over the past couple of years, that's become popular. Heroin has always been around. Inhalants, if they're huffing. We had a friend that a couple of teenagers stole some, I think it was the spray that you clean the keyboard with. They stole that from Walmart and were huffing it, and they were out driving around the neighborhood, and they missed a curb and ran right up into my friend's kid's bedroom. So, very dangerous. All right, some things to talk about with kids to discourage substance abuse. Tell them stories, show them pictures, and those are very impactful. That's what the high schools set up those programs to come, Mothers Against Drunk Driving, and they come in and show them pictures and talk about things like that. So those are very impactful, and sometimes it takes that slap in the face or that just horrible picture to really teach the impact of that. Okay. All right, so let's go to the chapter. Sorry, I should have been here already. All right. Now the first couple of sections go over the physical growth and development. Like I said, the teener stages aren't in here, but I put that picture in there in the slideshow for you. Here, just some general changes in for puberty. Spit it out. Talks about the early adolescent, mid-adolescent, and late adolescent. So that might be an important chart to know. This chapter probably has the best charts of any chapter that we've been through. Oh, I wanted to show you one thing. This video up here, the developmental, it's about a 6-minute video. It's worth watching. It talks to the identity versus role confusion, so you might want to watch that little video. All right, and again, physiological changes. It does mention teener stages down here. It also talks about the first signs of puberty changes, which might be important to know. First sign in boys is testicular enlargement. Now, boys can get something called gynecomastia. A lot of times they come into your office panicked because they have started developing breasts. Totally normal in the 14, 15-year-old age range. So, we have both hormones in our body, testosterone and estrogen, and sometimes it just one overpowers the other. So that's not uncommon. Gynecomastia is what it's called, but boys will panic when they see that. All right, diet, exercise, all affect height, weight. Very important to do BMIs at this point and address your findings, okay? If you see a trend starting to where they're becoming in the overweight, obese category, then you need to address that. Out in the community, there are clinics that focus just on that. Just on obesity in adolescents. So be aware, and that's, again, one of the benefits of plotting on a growth chart. A trend. All right, and again, all of this information are on those slides. So I think the information on the slides is all you need. This is a great chart. Okay, I would really pay attention to this chart. Okay, it talks about Piaget and Erickson's, and you know from past exams that these things are important to know. There. All right, gross motor, fine motor skills. They are being fine-tuned at this point. Okay, they're still a little clumsy. As they get towards the end of the school age and the beginning of the adolescence, their speed increases, their accuracy increases. They get a little more coordinated. So you'll start to see that kind of fine-tuned, the gross motor and the fine motor. Okay, communication. We talked about how to communicate with teenagers. Encourage the use of like full words and spelling, and stay away from the slang type talk. A lot of times it's hard to get these guys to even speak to each other. They'll text each other when they're sitting right next to someone, but so encourage that verbal communication, a phone call, an actual phone call, not like a voicemail. So encourage that. All right, and then this is, again, some ways to improve communication. The spoken word. Encourage the spoken word. There you go. That's a good hint. Self-concept and body image, huge in this age group. And it can be positive and it can be negative. So, in the body image thing can, if they have a poor body image, it can lead to eating disorders, depression, bullying. So a positive body image promotes that. I think these girls have a positive body image. I don't know. All right. This little research update was very interesting. I think this is the one. They did a research study about peer pressure, peer advice, and sexual activity, and they found that adolescents that had older brothers and sisters kind of did what they did. So they were more of an influence than their siblings were. So I thought that was interesting. Than their peers were. Their siblings were more an influence than their peers were. All right, and we talked about the attraction to same-sex, opposite-sex partners happens during adolescence. So all of that teaching about safe sex is very important. Cultural influences, again, it's a very important in all age groups to know what cultural influences will be important at this age. So make sure that you are familiar with those. All right, and this talks about post-concussion. It's becoming more and more recognized that head injuries can lead to cognitive delays later in life. So the concussion protocol in pro football now, I hope that carries over into the high school arena as well. I'm not real sure that it does across the board, but this little evidence-based practice blurb here talks about concussion and how long it takes to recover, et cetera, et cetera. All right, so here are your Healthy People 2020 objectives. This talks about educational achievement. Like I said, there are lots geared towards adolescents. It might not hurt to go to this website and pull this up and look at all of the ones that are adolescent focused. They range anywhere from education to exercise to, like I said, tanning, nutritional influences, safety things, definitely. All right, safety with this age range is a big deal because they seem like, or they think that they may be invincible. They don't think it could ever happen to them. They think they're Superman. But we need to make sure we stress that they are not Superman, and they do need to wear their seatbelt, and they do need to wear their helmet. So encourage safe. This is another great chart, teaching guideline. And you know from past exams that these are important to know. ATV safety, water safety, firearm safety, sunscreen. All important to know. I would read this section. We talked about nutrition. Remember that this and infancy are the two biggest iron, where you need the most iron, and they're the two most iron deficient states. So infancy and the teenage years, child needs more iron. And here are foods that are high in iron. Daily food, there's the food plan again. All right, here are some nursing interventions for preventing overweight and obesity. These are good things to know. Encourage proper nutrition, decrease the computer time, get off the couch, physical activity for at least 60 minutes a day. Parents setting a good example, very important. Sleep and rest is very important as well. Oh, there's even a Healthy People 2020 about, oh no, this is exercise. I was like, I didn't see one on sleep earlier, but 8.5 to 9.5 hours. And I can bet that the average that teenagers get is about 5 to 6 hours, if I were guessing. All right, and then there is the information on caring for body piercings and tattoos. Watch for infection. Tattoos can get infected. They have to be covered if you're going to be in the sun. So you may not be able to stop them from getting piercings and tattoos, especially if their parents allow that, but you can tell them how to treat if they see an issue with them or things to watch for. Okay, here's another Healthy People 2020 objective. Some more teaching points on adolescent sexuality, because it is such a big part of their life. Pregnancy, unwanted pregnancy, adoption, those are all maybe things that you have to address. One of the hardest visits that I ever did as a nurse practitioner was a patient that came in that, I think she probably knew she was pregnant, but mom brought her in. She had been throwing up, and we did a pregnancy test. We told mom we were going to do a pregnancy test. We did a pregnancy test. Sure enough, it was positive. And then, she had to tell her mom there. We couldn't legally tell the mom because it had to do with that whole consent, emancipated minor type situation that we talked about last time. But it was a very uncomfortable visit. So just be aware that that might happen if you see teenagers regularly in your practice. Promoting proper media use. Again, reduce the screen time, increase the activity level. That's important. Here's some things that contribute to adolescent violence. There was a slide on that as well. Gang relation or gang affiliation definitely will be a big factor contributing to violence and homicide. So if parents are concerned about that, an early intervention is important. And then some risk factors for suicide. Definitely comorbidities of mental illness or behavioral issues. It should put you on a heightened risk to look for suicide risk. Okay, again, all of these little charts, very important, are very good information. Okay, this is my favorite in the whole chapter. Gives you some street names for the drugs that are most commonly abused. I would just be aware of the most common ones: marijuana, heroin, prescription medication, alcohol. They're all, if you kind of know what kind of effect they give you, then that's about all you need to know about them. But it's good reading. This chart is just for your own, like bath salts: Bloom, Vanilla Sky, White Lightning. I think I have a bath gel that's called Vanilla Sky. I don't know. So, all right, and then tobacco. There's actually been a decrease in actual tobacco use, but an increase in those vapor cigarettes, which are just as bad. Tobacco includes, things like chewing tobacco, snuff, etc., cigarettes. And we do have to start asking about drugs or alcohol or tobacco use at age 10 when they come into the hospital. Alcohol is probably the most commonly abused drug as in the teenage years. 68% of students have had some sort of alcohol by the end of high school. 28% by the end of 8th grade. Oh my gosh, that's horrible. All right, so nursing interventions to decrease substance abuse. Again, tell them what it looks like. Tell them long-term effects. Show them pictures. Pictures are great. Impactful. Great is not the right word. And then here's your wonderful care plan at the end of the chapter. Talks about things from just the physical growth to the psychological well-being to coping mechanisms. So real important to read through the care plan. All right, that's all I've got. Y'all have a good day.